Anyone who deals with chronic stomach pain knows how exhausting it is. The bloating, the sudden cramps, the frantic rush to find a restroom. It feels like a chaotic storm is constantly raging inside you. When doctors try to identify the culprit behind that storm, they usually narrow it down to two main suspects: irritable bowel syndrome, or IBS, and inflammatory bowel disease, known as IBD. From the outside, these two look almost identical. They trigger the exact same symptoms. But if you look under the surface, they operate using completely different mechanisms. Mistaking one for the other is a recipe for frustration. You can spend years trying different diets and medications only to stay sick because you are treating the wrong problem. To finally get relief, we have to look past those surface symptoms and answer one question. Is your digestive system suffering from a software glitch or a physical hardware break? Your brain and belly are linked by a high-speed data cable. IBS breaks down this network, like static, scrambling messages. When stressed, the brain panics, spamming chaotic signals. The gut receives garbled instructions, either going into overdrive with diarrhea or completely freezing up. Looking closely at the intestines during an IBS flare-up, the tissue looks perfect. There isn't a single cut, tear, or physical wound in sight. Since IBS is an invisible signaling error, treatments trying to heal physical wounds won't help. Relief comes from managing the gut environment and calming that communication network back down. Now, let's look at the hardware break. Your intestinal wall is a solid physical fortress, keeping dangerous waste and microbes safely out of your bloodstream. Inflammatory bowel disease happens when that physical fortress takes structural damage. The wall actively degrades, cracking open and becoming severely inflamed. Recent studies on patients in North India revealed what happens next. When the wall breaks down, it creates a specific vulnerability. A group of mouth intruders, germs safe in your mouth but chaotic in your gut, slip down and embed themselves in those open cracks. These misplaced mouth bacteria set up colonies inside the open wounds. Their presence irritates surrounding tissue, driving up inflammation and physically blocking the wall from healing. This means IBD is a serious structural emergency. The body's physical defenses are being dismantled by microscopic invaders. To fix it, you have to physically repair the broken wall and evict those invasive bacteria. So if you're suffering from terrible stomach pain, how do you figure out if you have a glitchy phone line or a broken fortress wall without doing invasive surgery? You can perform a microbiome security audit. By analyzing a small stool sample, science can identify exactly which bacteria are currently living in your digestive tract. If the test detects a large population of those migrating mouth bacteria, it reveals the structural damage of IBD. If those specific bugs are missing, it points strongly towards the software glitch of IBS. A tool like BugSpeaks maps out all of these microscopic tenants. It gives you a clear, readable report on your gut's exact status. Once you identify the specific problem, you can deploy a highly personalized repair crew using specific foods to target the issue. For IBD, high-fiber foods like lentils provide the raw materials your gut needs to produce butyrate, a type of biological cement that actually seals those cracks in the wall. And for IBS, the live cultures in curd and buttermilk act like microscopic peacekeepers, crowding out the noisy bacteria to help quiet the static on that phone line. By using a microbiome test to uncover the hidden microscopic truth, you can stop guessing at your symptoms. You can deploy the right repair crew and finally start rebuilding a healthy, resilient gut.